Our last speaker in this panel is Tamara Valovich McLeod, and Dr. McLeod is an endowed professor at A.T. Still University in Mesa, Arizona. She completed her PhD in sports medicine here at the University of Virginia, and she is the director of the Athletic Training Practice-Based Research Network, and her research is focused on pediatric athlete with a particular interest in sports-related concussion. Today she's going to talk about the impact of sport-related injury on health-related quality of life.
Thank you. It is nice to always come back and visit and present. So we're going to talk a little bit today on health-related quality of life and how that relates to participation in physical activity and sport. We'll talk a little bit and try and characterize the quality of life of adolescent athletes, and then talk about how sport-related injury, more so from a musculoskeletal standpoint, as well as concussion, impacts quality of life. And we know that there are a lot of children who participate in organized sports, both at the kind of club or community level as well as at the secondary school level. And there's a lot of benefits to participating in sports, so it's not that we don't want children to do that. We obviously want to gain those physical and psychosocial benefits. But the big negative that we tend to see that was discussed earlier is sport-related injury. And there are over 3 million injuries that result in time lost from organized sport. They result in medical visits, whether to the emergency department, which from a financial standpoint to the healthcare system, it is definitely a big, large amount of money. And interestingly, we see that when students tend to be injured from participating in sport, they also miss school, their parents miss work, and there's a lot of other consequences that can occur from these injuries. In fact, Dr. Yanda's book really talked about student athletes who are missing school because of sport-related injury. When you add up those days, it's about 20 million days of lost school because they're being treated or seen for their particular sport-related injuries. And a lot of times when we look at these injuries, we really look at it from the standpoint, if we look at the International Classification Framework, of impairment, or what is going on at the structure or the organ level, and are not really looking at the whole person and how these injuries affect them besides pain and some of the other immediate symptoms. And we can look at that in a couple of different ways. We can look at the dollars and cents, and that is something that policymakers are really looking at. What do these types of injuries cost? As well as what's more important to us and what we've been studying is the impact on the individual athlete, on them as a person. And we see the effects of the physical injury. They can't participate in their sports. But what we've started to look at are what are the additional psychosocial effects that these kids tend to have. Their identity is tied into participating in sports. They're known as the starting quarterback, the pitcher, the third baseman. And now if we kind of take that identity away from them, how does that impact them on a much larger level? And we've really started to look at that through the concept of quality of life and health-related quality of life. And this is kind of a more global concept that goes beyond just the physical nature of an injury to look into social, psychological, economic, spiritual, and physiologic components of the injury. And it is a central component of what is termed whole person healthcare, and I'm at an institution that grew from the first school of osteopathy in the country, and we really look at whole person healthcare, mind, body, spirit, and really kind of taking the approach that if we want to look at an injury and we want to rehabilitate an injury, we need to involve the whole person. We can't just look at trying to fix what is physically wrong. The patient is central, and narrative health history is a key component. And so a lot of our studies may start out as a quantitative study, but we've been following them with a lot of qualitative work to really get the story behind some of the quantitative data that we've been getting. And this really, when we start to go back to this disability framework, gets at the idea of activities and participation. And now we're trying to put all of these components together to get a much better picture of how these sport injuries are impacting these young athletes. So why should we do this? Well, if we look from a healthcare system and kind of look more broadly from a policy standpoint, some of the trends from funding agencies, looking at the need for comparative effectiveness research, trying to facilitate evidence-based practice to know what kinds of treatments work across healthcare are important. And many of our governmental agencies have a common language. For example, the National Institute for Neurologic Disorders has the common data elements. So all studies of traumatic brain injury need to include these certain common data elements. And that becomes important that everyone is kind of speaking the same language. More importantly, I think if we look clinically, or what we like to call patient-focused, is that injuries are going to affect every person differently. It's going to be kind of their predisposition, their individual personality, and people are going to react differently to the same condition. We've seen that, among professional sports, high school level, that two people have the same injury and their recovery, their reaction to all of that is very different. Health-related quality of life tends to be known as a comprehensive health indicator, and we're really getting the patient's perspective, which is key in today's healthcare climate. And we studied this and published a couple of papers that really looked at this specific to the profession of athletic training, and through that have built a practice-based research network where we have 60 clinical practice sites at high schools, colleges, and within hospital settings across the country. And our goal is really to identify the patient perspective related to sport-related injury, to look at the types of injuries that these young athletes are sustaining, as well as to identify appropriate, effective, and cost-efficient treatments. And part of what we initially have started was really looking at this concept of quality of life. And we can't do it the same way that we would with adults, because the young adolescent, their life revolves around school, around their extracurricular activities, including sport, their social interactions, and for a lot of them, those are teammates, as well as their family. And these do play a role in not only their self-esteem, but also their academic interactions and sport participation, and all of these have been impacted by other chronic conditions that we might see. And so we've kind of started with a series of questions, and there are others who are doing some great work in this area, but we really wanted to get at, can adolescents reliably report their own health-related quality of life? Does the health-related quality of life of athletes differ from non-athlete peers? And then really getting into how does injury affect their quality of life? So we started looking at some retrospective data about prior injury history. We started looking prospectively at current injury status, and then from a qualitative standpoint, what meanings do these adolescents have for their particular injuries? And we've published several papers, and others have as well, really looking at can adolescents, again, reliably report this? This is a bit of a subjective outcome variable, and they can relate it to concussion symptoms, they can relate it to some upper extremity disability scores, as well as some knee-specific instruments. We've then started to look at whether athletes are different. A lot of these outcome measures have normative values, but we anticipated that athletes would actually have better health-related quality of life because a lot of the benefits that we know of participating in physical activity and sport. And we published 2 papers that have found the same thing, that athletes report higher quality of life than non-athlete peers, specifically related to mental, emotional, and physical well-being. And then secondly, we took a cohort of our adolescent athletes and compared them to established norms for the Pediatric Quality of Life Inventory. And we found that, again, athletes reported better quality of life related to emotional functioning and do appear to be their own specific unique population that the current normative data it does not work as well for them. So this is a good thing because it does suggest that by participating in physical activity and sports, that's a benefit to the overall quality of life and perceived well-being of adolescents. We even looked at some differences between males and females, and not surprisingly there were. We actually found that males reported higher psychological well-being than females, and higher quality of life on all of the subscales except for social functioning of the pediatric quality of life inventory. And this becomes important, I think, when we start to look post-injury and how these are managed and making sure that we're attempting to look at kind of these psychosocial and more global components during recovery. It was mentioned earlier that prior injury history can lead to individuals dropping out of sport and not continuing to participate. And some of our data may tend to support this. We've done several studies in different adolescent populations looking at prior injury history and how that may affect quality of life. In a series of studies in young throwers, and we know that throwing athletes who play Little League and high school baseball tend to have a lot of overuse injuries, and that can be problematic and can lead to dropping out of sport. But those who had a history of arm and shoulder injuries that resulted in restrictions in participation had lower quality of life. Those who were seeing a physician for a pitching-related injury, or those who had a prior surgery on the arm or shoulder from a pitching-related injury, were all associated with lower quality of life scores. We've also seen this with concussion, and interestingly, with our positive concussion history group in 2 separate studies, we found that they tended to note deficits in more of the emotional or mental composite components of quality of life as opposed to the physical. So there is the potential that this, prior concussions could lead to some deficits across time, or at least perceived deficits in their emotional well-being. We've also found this to be a bit of a dose-response relationship. In one study, we looked at collegiate athletes, and we looked at athletes who had no prior concussions, those with 1 or 2 previous concussions, and those with 3 or more. And there was a bit of a dose-response relationship across all of the domains of all of the outcome measures, specifically related to bodily pain, lower vitality, lower social functioning, and an increased impact of headache among those in the group that had 3 or more prior concussions. Now, from a prospective standpoint, we really wanted to look at if we kind of know this baseline measure of quality of life for these athletes and that it's higher than their non-athlete peers, what happens once they're injured? And what does that mean? And we found that those who had a self-report recent injury had lower physical functioning, not surprisingly. If they're in that 1-week time span where they're out of play, there are obviously some physical issues. Also increased pain, but we noticed lower social functioning as well as a lower global quality of life. And in some of our qualitative interviews, it's really come out, especially in those athletes that sustain a season-ending injury, that they've now kind of lost their social identity. They're not around the team during practices and games. They miss out on all of that interaction within the locker room, and to them that's a huge loss. Maybe even more so than actually not being on the field, but being in that social environment. Some work by Tim McGuine out of Wisconsin. He's done some fabulous work with adolescent athletes using a knee-specific scale as well as the SF-12, which is a global quality of life measure. Also found deficits in quality of life measures related to knee injuries. And the SF-12 subscale scores significantly lower across the board after injury. So it's nice to see this being done elsewhere, and now with specific types of injuries that can perhaps help rehabilitation specialists to get these athletes back to play in a more appropriate and kind of whole person manner. There's also some great work out of Canada that has looked at this emotional response after concussion. And they found that within the first 3 weeks in collegiate athletes, there was an increase in depression, confusion, and mood disturbance, which gets a lot of what Dr. Broshe was saying with some of the emotional issues. There was also increased fatigue and decreased vigor when compared to athletes with a musculoskeletal injury. So the way that they respond to a concussion differs from musculoskeletal injury. And that relative to controls, concussed athletes had greater total mood disturbance and depression, but less depression than peers who tore an ACL and were going to be out for the season. So there's kind of this spectrum of how this quality of life can be affected by injury, but several studies in several different areas and several different age groups are reporting the potential for these deficits. More recent work in high school and college athletes found, again, increased depression scores up to 14 days following a concussion. And it's not surprising when we start to look at some of the potential long-term effects that former NFL athletes have exhibited related to depression and psychosocial functioning. In some of our work with adolescent athletes, we found that after a concussion, they noted a greater impact on their physical functioning, sleep fatigue, cognitive fatigue, and the impact of headache. And a lot of this relates to the types of symptoms that they were probably having at the time, where they're restricted from activity and they're symptomatic. So the lower quality of life is probably related to the fact that they are experiencing some symptoms, but they're also being told they need to rest physically, and in some cases they need to rest mentally, so they might not be at school at all, again, away from those social peer groups. And this is really related to their time lost. How long are they held out of participation can play a key role. Some correlations that we ran from one of our studies found the strongest associations at day 3 and day 10. And I think what's most interesting is that, at least to me, and we've started to follow up on a lot of this work, is of all of the quality of life domains, the one that was impacted the greatest was related to school functioning. So I think it speaks to the symptoms, it speaks to the potential cognitive impact, and these kids being held out of not only activity, but also of school. When we look at this qualitatively, we get some very interesting data. For every athlete that's held out of participation for more than 10 days, we attempt to do a qualitative interview with the athlete and a separate interview with the parents to truly get the patient perspective as well as the parent perspective. And we're really looking to identify what meaning do they give to their injury, how do their injuries lead to perceptions and quality of life, and how does this really change over time. And when we look across all sport-related injuries, these are primarily musculoskeletal from this first data set, what we notice is that it's a loss or challenge to their identity. The idea of being an athlete is a valued component of who they are and who other people see them as, and this really results in them having to kind of reevaluate where they stand within their social and peer structures. Some of these quotes are long and they're verbatim, so they definitely sound like adolescents talking. But first off, we always get that, well, I didn't think it was going to happen to me. I wasn't the one who was going to be injured. We also get quotes related to a disruption of social network, and they feel like they're losing friends because they can't be a part of a lot of the activities that they were a part of previously. And then there's this emotional consequence that they express in their own words. They're angry, they're sad, it's hard to deal with. Maybe if I hang out with my friends and go to a movie, but it's not quite the same thing as being in the locker room or being part of the team traveling on the bus. And we've looked at this specific to concussion, and 3 themes have really emerged from this line of work. The first is that the athlete feels isolated. They can't participate in physical activity, they're not fully engaged in school, and so in order to try and get away from that, they actually try and minimize and mask their symptoms. They start to tell everyone, I'm feeling okay, I'm feeling a lot better, and that leads into kind of this, what we've termed as emotional slippage, but it leads to a lot of disconnect between the athlete and the parents. And the parents are telling them, well, you've been told you need to rest, I'm feeling better, and it actually leads to some familial problems with respect to how they're interacting with their parents. And a lot of this relates to their performance deficits in school. Probably every interview we've done with parents, one of the statements that is made is something along the lines of, I didn't realize the concussion was going to affect how they were doing in school. We get that almost all the time. The way that the parents and the kids prioritize the effects of the injury are very different. And again, the academic accommodations component is one that we started to look in further because we were getting a lot of quotes and information from the parents about their lack of knowledge about that and how to integrate it into the school. So from some of our prospective work, we started to look at what accommodations are being done. This is from 144 adolescents, and about 28% had missed some school, and about 16% received some type of academic accommodations. Interestingly, when we started to look at some of this data compared to, the shorter day was probably the most frequent accommodation type. But when we looked at this related to a lot of the quality of life measures that we had for these student athletes, those that had accommodations tended to have more days of missed school and then deficits on a lot of the health-related quality of life measures that we had taken. And those who had a school absence also had some day of injury symptoms that tended to increase the probability that they would have school absences following the injury. But then they also had a lot of deficits noted on some of the day 3 and day 10 quality of life measures. And so we've attempted to look at this a little bit further with a survey, the beliefs, attitude, and knowledge of pediatric concussion, that's been administered to athletic trainers, primary care providers through the National Research Network, and the school nurse survey actually just went out this morning, I was informed. And then we're working with the school counselors to really look at how this is affecting this concept of academic accommodations related to quality of life is affecting them. We know that about 80% of athletic trainers have worked with student athletes who had academic accommodations following concussion. And so what we've really been able to do is identify that health-related quality of life is affected. It's usually better in our adolescent athletes, but those with a prior injury history, even if they're cleared to participate and technically injury-free, still demonstrate some deficits. And we definitely see this following new injuries, it does impact them in a number of ways pertaining to their sense of self. And if we look at, in conclusion, for those of you that are interested in this area, this is a fantastic editorial by Dr. Stovitz that was published in the British Journal of Sports Medicine a couple of years ago that really looks at how sports medicine practitioners can influence a child's overall health and well-being. And it really gets at ensuring that they not only have physical well-being, but also emotional well-being. And I think the quality of life issue really speaks to that. So with that, I'd like to thank my colleagues at ATSU as well as the individuals and agencies that have funded our work. And I will take any questions with the rest of the panel. Thank you.